Good morning, one and all. On behalf of Journal of Indian Speech and Hearing editorial team, I, Shwetha Prabhu, and Dr. Ruben Jibraj, Associate Editors, will be hosting today's webinar. We would like to welcome you all to the fourth webinar of the series hosted by JISHA. Today's webinar is titled Research Proposal Writing, and we have with us Dr. Prakash as the resource person for the webinar. I request Dr. Ruben to introduce today's resource person. You're on mute. Yeah.
Thank you so much, Shwetha. I hope I'm audible.
Yeah, you're audible.
Yeah. I would like to introduce our resource person for the day. Dr. Prakash P. embarked on his professional journey following his graduation and post-graduation in speech and hearing from All India Institute of Speech and Hearing, AISH, Mysore. He also completed his PhD in audiology from Manipal University. He is currently working as an associate professor at Manipal College of Health Professions in Manipal, Karnataka. With a wealth of over 16 years of teaching and research experience, he serves as a valuable asset as an academician and as a member of the Institutional Research Committee, Internal Quality Assurance Cell, IQAC, and Board of Studies at Manipal University and other external universities. His primary area of interest is diagnostic audiology, and his current research focuses on dichotic listening, auditory cognition, learning disability, tinnitus, cortical network, auditory processing in aging, listening effort, and neurofeedback. He has over 39 publications in Scopus Index journals and has supervised 5 PhD scholars and has been a resource person for 36 scientific events such as conferences, workshops, and seminars. Additionally, he has secured approximately 2 crores in extramural research grants from central government agencies like ICMR and TST. Rightly so, we have an eminent resource person who has kindly agreed to present this topic on research proposal writing. We welcome you, sir, and thank you so much for accepting our invitation. Over to you, sir.
Thank you, Ruben. Thank you for the kind introduction. Just a minute, I'll just close my door and come.
I request everyone to type in the queries in the chat box, so which will be answered at the end of the webinar. I wish everyone a fruitful learning session. Over to you, sir.
Can you see my slides? Right? Okay, so today we are going to talk about the research proposal writing, or you can say as in general manuscript writing. But in a proposal, okay, so we will have only till the data analysis and possible implication, but then in a manuscript, you will have further results and discussion that would not be there as a part of proposal. Okay, so right now we will have, okay, so only as a proposal framework. So we will be seeing only till data analysis. Okay, yeah. So whatever I'm going to say is from my knowledge. Okay, so and there is no best way of writing anything as such. Okay, so this is not the best ever way, but then like these are just based on the training workshops that we have gone through and what people have taught us and from the experience of whatever we have written. Okay, so this could be an value addition to the things that you already know. Okay, so let's start with introduction section. Yeah, so the first section of any research proposal is introduction. Okay, so introduction can be conceptually considered as an funnel. Okay, so it has to start as broad as possible, right? Okay, so and then it ends up in a very narrow leading to a research question, right, that you would answer in that particular manuscript or proposal. Okay, yeah. So it has to start broad, okay, so but it does not include so much broad. So we will see some example of like, as I said, like, if I have to just explain theoretically, I can say broad, but not as much broad as possible. But when we see some examples, you will get to understand what do we exactly mean by broadness and not so much broad means. Okay, yeah. So introduction starts with very broad, and as I said, it leads to the need for the study. It leads to the need. Okay, so there are two main purposes. One, introduce the key variables that are studied in your proposal, okay, or introduce the concept behind the key variables that you are studying in your proposal. Okay, so mainly we should think that audience, okay, suppose if you are writing it to an audiology journal as such, right, okay, so then you would know who are the readers. Suppose if you are submitting it to some general cognitive psychology or cognitive linguistics or some methods journal, right, okay, so or something like that, okay, so then we should keep broad audience in mind. Okay, yeah. So the introduction can be thought of, introducing some guest in your dice. Suppose if you are, if suppose like how Ruben had wanted to, means Ruben had introduced to me. Okay, so he means whatever is relevant to this webinar. So that is what is the introduction. He never mentioned where I was born, when I was born, and who are my this thing, which is my place, etc., etc. Yeah, so exactly that's what we mean. Okay, suppose for an example, if you're talking about yoga and memory as a concept paper, so then what is the two key variables that we want to include in your manuscript is about yoga and memory, of course. And that yoga and memory, the concept that you are writing in introduction should be directly related to your need for the study. So don't mention that, historically yoga started in some centuries and etc., etc. Right. And second, okay, so as I said, this is a framework for establishing the importance of the work that you are addressing. So ultimately, so keep your research question in mind. Okay, so and then key variables in mind. Okay, so then start explaining those variables, right, or factors. Okay, so keeping the need in mind, in the sense like deriving it to the need. Okay, yeah. So do not include many content as such, right? Just for the sake of increasing the pages or increasing the volume. Okay, so mainly it would lead to almost like then there may not be much difference between a tutorial article or a review article or a textbook for that sake, right? Okay, and then literature should consist of thorough sweep of literature, right? Which doesn't mean that you have to say everything. Once again, it has to be highly relevant to the need, right? Directly relates to your research is what we need, right? And do not talk about anything that is not covered in your need or that you're not addressing in your study. Okay. Sometimes you can use context in place, say for example, past 10 years, okay, since 1990s, or such statements, okay, or say for example, there is a recent increase in interest in studying of, tinnitus, something like that. Okay, so you can use context as a reference to, right? Okay, so and then some important information that you want to convey. Okay, so would need definitely some references. Say for example, if I'm saying, say, audiology is a field, so that doesn't require a reference. But then when I'm saying tinnitus influences speech perception, yes, that definitely requires some references, because that's not my statement. I take the support of literature to say that, okay, so this is already a well established one, right? Okay, so but it should not be too many references. As I said, do not put references for every statement that we are writing. And the kind of references that we write in introduction should be slightly different from what we write in review. Okay, so the review here, what I mean is the typical review of literature that we write in your dissertation. Okay, so it should not be like that. Say for example, consider if I have to say for example, Mohan 2021 reported that there is an additional factors that affect IQ, like so and so. right? Okay, so instead of writing like that, okay, so we can write that there are additional factors, which means to say I'm telling from my perspective with reference to somebody else. So it should not be like reiterating what is the statements, or as if that I'm not taking responsibility of whatever I'm saying. See, he reported as such, like that. Okay, so it should be you who says, but then you take references for the claim that you are making, right? Okay. Yeah, these are some of the examples, right? Okay, so that I want to say, so that to make you understand whatever we said till now. Say for example, if a paper, these are taken from online sources, okay, you also can find it. Okay, say for example, the first example says that, okay, so it's a paper on organic matter, okay, in soil. Okay, so then the introduction should begin something like, the sustainable crop production is a function of physical, chemical, and biological properties of soil, in which in turn markedly affected by organic matters in the soil. Yeah, something like that. What is unpreferred way of starting? See, what is soil? Soil is an important part of something like that. Say, what is the biological or chemical or biological properties of soil means, so and so. So this is not required, because everybody does understand what do you mean by a soil, or what do you mean by a biological property, right? Okay, yeah, that's what we mean. Okay, so second, say for example, another paper which talks about the role of beneficial bacteria in treating cancer, should begin something like, the role of bacteria in anti-cancer agents is recognized almost like years back. So that's also fine, but then we should not go back and talk about what is in bacteria. Say bacteria is a microorganism, should not say cancer. Cancer is an disease, like something like that. So that is not something which is expected. So just a minute, I'll just connect it to a power source. Yeah. Yeah. And again, another example is on lithium batteries. Say, for example, rapid growth of lithium ion batteries and their new uses, such as powering electrical car, etc., etc. So you can say grid supply, demand more reliable methods, etc. But what is unexpected is explaining what is lithium, right? Explaining what is batteries. Batteries are defined as. Don't define what is electrical cars, right? Etc. Etc. Right? Okay. So while writing introduction, okay, so see, the research says that the average reading span of a reader, okay, is somewhere around 30 seconds, right? Okay, so which means to say, if you want people to read your article fully, or if you at least you want to go through them a little longer than that initial uh, you know uh, initial gazing period, okay, so at least you need to make some impact, because there are some ways, but then it is little like it cannot be used every time. It has to be really an impactful research in order to use such statements. So these are called as hook statements. Say for example, in that below example, I've written an example of how you can attract the reader's interest by putting in hook statement. Say for example, are cows responsible for climate change? No one ever would have thought that how a cow could be related to one climatic change, but then it is possible. So if you think that this is relevant, so then, and your research address something that is completely new that no one was knowing about it, so then definitely you can use an hook statement. So basically it is a study which says that 46% of total nitrogen emission, okay, so is mainly by the cattle farmers. But then I could have started simply saying that the cattle farmers are one of the largest producer of nitrogen, etc., in the thing in agricultural nitrogen emissions in Netherlands. So we could have started like that. But then the statement that are cows responsible for climate change is an hook statement which glues the reader, get to the context little more longer than their normal reading period. Okay. So that's the reason why introduction should not begin very, very broad. It might be very childish for the readers that, they will not get to know what impact you want to make, how important is the study. Okay, so that initial reading period would be about some definitions and, prevalences, so which might not be of very interest for them. Okay, so consider writing very concise, very efficient way of starting the introduction so that it serves you, uh, uh, like it serves the purpose of that manuscript or proposal, right? Okay, so as I said, okay, so in summary, introduction should have key concepts that are highly related to the need. Do not discuss anything that you are not going to take up in the research, in your article, right? Okay, so only write those key concepts that are highly related to your research question. Okay, so and then relate the concepts, right? Say, for example, you had like yoga and memory. So you describe about yoga, describe about memory, but then ultimately you should come to some, means you should relate these two in such a way that why that study is about studying yoga and cognition, right? Okay, so and it should definitely have adequate references for the important claims that you make, but it should not be almost like a literature review per se, like your dissertation literature review. Okay, yeah. So the next section of introduction, or sometimes research gap, can be considered as a separate section itself. Okay, but then while writing in a proposal, so it is generally considered as a separate section, but in a manuscript it is considered as an inherent portion of the introduction or a section of introduction. Yeah. So this gap, research gap, right? Okay, so after introducing the concepts, after relating the concepts, and reviewing the literature, important literature that are related to the key concepts of your paper. So now it is time to report what is the gap, okay, in the existing knowledge. Right? Okay, so that very simple key terms you can remember in your mind, and then when you're writing the research proposal, like use this as a acronym, like how well a particular instrument works in a particular situation. So that, like that is a kind of gap, right? That means to say, if you think that it's a motorcycle runs everywhere, but then will this motorcycle run in water? We don't know. So probably, so that is a gap. Will this be able to run in a particular terrain? Yes, that is a gap. Okay, so like that. Okay, so it may not work in every place. It might not be suitable for every time. Okay, so consider, okay, so the particular instrument, how well it works in a particular situation. So that could be a possible gap. Say, for example, it could be completely new method of testing. Say for example, there are some method of testing. Okay, so like we were not knowing before that RT-PCR is used for like identifying COVID. Even if it would have been in practice, it wasn't commonly used in like for disease detection. But then after COVID, we now know that RT-PCR should have been so much handy that it has to be used for testing the COVID viruses. So a completely new method, right? Like a vaccine, right? Okay, so that needs to be tested. So that also can be a particular need. Studying a new organism or a system or a process also is a particular gap. Okay, so and also your product may include multiple gaps. Okay, so but then it is generally not so much advised. Okay, so at least you should be very specific to a particular thing. Suppose if we have so many gaps, then you should frame aims in such a way that there should be multiple aims and multiple methods to address this gap. So don't dump all the gaps in one place, that there might be so many gaps, like we don't know whether this works in this particular language, we don't know whether this works in children, we don't know whether this works in school setting, etc., etc. But you would go ahead and study only one of it is not actually advised. So ideally mention the gap that you are addressing, right? Though there are multiple gaps, if you are tackling multiple gaps in your research proposal, okay, so then you should go ahead and devise multiple independent methodologies to address these gaps. Okay. So we will see some example. Okay, so it has to be explicitly seen in manuscript. Okay, so this is an example. Say in relation between four damping factors. So probably this means to say that manuscript would have talked about four damping factors in the introduction. So that is the internal friction, support loss, airflow in free space, and squeeze force has not yet been clarified, which means to say the relationship is not known. So there are four factors, but the relationship is not known. So it is obvious that which one is dominant is actually in microsystem is a gap. So that means you don't know the relationship between the force, these force, damping forces, and if there are four forces, or which one is dominant is also not known. So that is a clear gap. Okay, so other phrases that can be used for stating gap clearly are it has not been studied, reported, elucidated, or the key question remains unanswered. It is important to address, right? It's a etc. etc. So these are some statements that can be used. So this is a small exercise. Okay, so you can try reading this paragraph and tell me which sentence or which phrase is actually talking about gap, right? We'll just give 1 minute time, then I'll tell you the answer. Yeah. Could you identify the gap statement in this paragraphs? Right? If so, just can you raise your hands? How many of you could identify? Yes, one, two. Okay, there are some two hands I can see. Others? Could you read at least? So if you are unable to find it, is fine. But now we will talk about it. Say, for example, see, this is the gap. So that is the according to the National Monitoring Program Portugal, that particular bacteria was not reported along the Portuguese coast during past 10-year period. Yes, so that is a gap. Exactly. Right. Okay. So similarly here in the second thing, so the factors that promote the scrambling process in McDonald type 2+2 something considerations are poorly understood, right? Yeah. So that is a gap statement. So if you are able to identify, yes, so that means you are making some progress. Yeah. I just want to. Yeah. So that's a gap statement. So then we will move to the next section. The gap statement immediately follows by need statement, right? Okay, so it should the need should be exactly addressing what is the gap. So that's the reason that it immediately follows the gap statements. Okay, so it should be immediately following, immediately relate to the gap that you have mentioned previously. It should be significant enough to contribute, right? Okay, so the need is justification, not the gap. So many people clearly gets confused between the need and the gap. Say, for example, if you say that something is not known is still a gap, okay, so you need to make an impact, or you need to make you need to state your motivation, as in why to pursue that gap, first thing. Second thing, and how pursuing this gap actually adds up to the existing literature, or how does your research contributes to the literature or the entire subject area as such. Okay, so it is must that we need to mention that. Okay, so there are some examples. Okay, so we can see them. Okay, so if there is a new potential treatment for human disease, right? Imagine if there is a particular treatment, so that is already proven in animals, right? Okay, it has been proved in animals. This is an existing statement. So now we are talking about the need. However, it necessary to prove. It's not that it is not proved. If you say that it is not proved in humans, that becomes a gap, not a need. But then you need to justify why you need to study this, not just to mention the gap. So, however, it is necessary to prove that this treatment works on humans, because many treatment that works on animals are not necessary to be behave the same way in humans. So that's a need basically. Okay, so you need to mention gap, and then you need to write your motivation and how that contributes to your means how your study contributes to the literature, right? Okay, second thing. So second example we'll see, if there is a research on new technology that can reduce the severity of vehicle crashes, okay, so then you can see it as two perspectives. Suppose if it is a new study, an innovation that uh, which means to say that there is no such previous technology was available, then the need to develop is, say for example, we can write like, currently the incidence of RTA, road traffic accidents, is very high. Okay, so that's why we need to develop this such a system in order to reduce RTA. So that's the impact, and how that is the need for it. Suppose if it is a translational study, you imagine you have developed it in your lab and you are only worried whether it's going to work in real world or not. So then what we should write is you should say that it is proven in lab, but then its actual implementation in field needs to be tested. Okay, so before implementing in real vehicle or in real life. So these are the need. So they all might look the same, because it might take some amount of practice and exercise. So in order to make it very clear distinction between the gap and the need, right? Okay, so but then if you means it is not that it is not achievable, it can be achieved with practice, right? Okay. So there's another way of writing this, that is writing it as a problem statement. Sometimes some proposals, okay, so for grants or for some journal formats, so they might be asking. It is more common to use this type of problem statements in management studies and technological studies. Okay, yeah, but it's pretty much the same thing. Okay, so there are several steps. Like the problem statement is it's almost like a combination of need and gap and the need. Okay, but then it has roughly 3 steps actually. Sometimes when they ask you to write the problem statement separately, so then which means you need to write it a little elaborate, okay, so not so much narrow like how we wrote the need and the gap and the need like in 1 or 2 sentences is not sufficient, so you need to write it a little more. Okay, so that's why these steps apply. First is conceptualizing the problem. So here you would be writing about already what is known. It's the kind of introduction that you write in your literature. So giving some background, okay, on what is already known, that is you're conceptualizing your problem, and then show why it matters. That means to say, again, like it is kind of need. So the problem statement should also address the relevance of the reach and why that problem is important. As I said, increasing road traffic accidents, right? Okay, so and a lot of mishaps in the road traffic accidents, loss of life, or say for example, their financial burden, etc., etc. Those are the current problems, right? Okay, so that people face. So that's why you need to address it, right? Okay, so etc. And this whole problem statement should be roughly around a page. So if it is asked to be written separately, and obviously it should not include any literature references, right? It should be like, after writing all the literature references, you should be writing about the literature. Say for example, it's like a summary, you can say, like, after writing the introduction, after you introduce the research topic, and after you you go through the relevant literature, right? Okay, so after that you say that, so in summary, we know that because there are studies which have shown that so and so, okay, are related. Okay, so and after that, okay, so we can write all this problem statements. So the problem statement should end with your aim and objectives. Okay, so that means to say that aim of the study is to determine. So that's why the project aims to explore. So this research aims to investigate, etc. Okay, say if you consider it a continuation of this. Okay, so however, before implementing, it needs to be tested in the field. So that's why the current project or current study aims to test this particular technology in field, like that. Okay, so that's about the problem statement. So this is one example of a problem statement that I wrote. Is obviously it is not about a page. Okay, so but then I just wrote it just for the sake of making people understand. Say for example, it has all these three sections. So first I'm conceptualizing the problem. So I'm saying that the CAPD is a brain's ability to process auditory processing, means auditory information. So making it difficult to understand speech, especially noise environment. This is all we know it. Binaural interaction is a category of auditory processing signal from both ears. It is crucial, right, for understanding speech and localization. So individuals with CAPD often exhibit deficiencies dash and dash. Okay, so, but the specific nature of these deficits is not well understood, especially in older adults. So this is a gap. So I ended with known literature and a possible gap. And then the second section is justifying why it matters. So we say that understanding minor interaction component is essential for developing effective diagnostic tools and intervention strategies. Addressing these deficiencies can improve communication, social, educational, and occupational dash dash. So this research is also broader implication for people with auditory processing disorder, such as older adults. And then your aim of the study. So that's why the project aims to investigate specific nature of binaural interaction deficits in individuals with CAPD using quantitative method, including auditory tests and brain imaging. So just hypothetical, but I'm just writing it to put it perspective. Because will be used to assess binaural processing. Because these findings will be compared with the control group without, etc. So that overall the study aims to enhance the diagnostic criteria and therapeutic approaches in CAPD in older adults. So now you understand how when we speak theoretical and how with an example, like how exactly they all fall in place. Yeah, so with that, so we finished introduction. So we finished research cap, and then we finished need statement. Okay, so and then all of them combined together can be written as a problem statement. So that also we have seen how to write it. Okay. And then we will move on to the next section, method. Okay. The method in a research proposal, okay, so is the section where you explain how you would want to carry out. If it is a proposal, if it is a manuscript, then how you carried out your research. Okay, so this section is essential. So when you write it, you should keep it in mind why you're writing this. We know that method is something that we write it usually in research paper, but then the main purpose of the research paper, okay, so is for the readers to understand how quality means what quality your research is first. Second, they also should be able to replicate the exact findings by following how you have done your study. Okay, so the both two purposes. So that means it has to be looking at your method, people can come to an understanding about what is the quality of your study first. Second, they also should be able to follow your protocol and get same results in turn, right? So research, your method has to be that much detail or sufficient detail in such a way that it can lead to same results, okay, if somebody follows your method section. So that much you should keep it in your mind, and you can write as much elaborate as possible. No one will tell that this information is not useful, unless, like how we mentioned in introduction, like you don't start it too broad, don't lose the interest of the reader. Okay, so these things doesn't apply to method. In fact, method can be as much detailed as possible. Okay, so usually we follow that in dissertations or thesis, PhD thesis, etc. But sometimes, due to manuscript, sometimes there would be some restriction in terms of uh, what do you say? Like there would be some restriction in terms of the number of words or pages or something. Okay, so that time what is necessary is we need to restrict so our writing to highlight that thing that is very, very important, and some standardized procedures can be left it off as such. In some cases, okay, so you can provide it as a supplementary material. Okay, so supplementary material. If you think that if these informations has to be known in order to replicate your findings, right? Okay, so that way. So what I meant to say is, do not ignore anything thinking that so this is not worth mentioning in the method. Okay, so you write as much as possible. Okay, so but then at the end we can revise, and then you can consider what is standard, right, and what is that you have experimentally done, so that needs to be mentioned explicitly in the method, etc. So that can be come to consensus by discussion from your author groups. Okay, so but the ideal sections, so if not explicitly mentioned as sections, okay, so but it should have those compartments or information related to these sections. Okay, so ideal section in a method should include participants, materials, or measures that are used. Okay, so then procedure, and then finally analysis plan. Okay, so we will see them one by one. Yeah, so in participants, so there should be clear information about who are your study participants, right? Say, for example, individuals with CAPD, etc. If it is a normative study, say children age range of, say, for example, 5 to 7 years, etc. Then how many of them? So in order to do this, actually, you could go ahead and present any number. Okay, so but then if you can substantiate with some measures of sample size estimation, right? Or you have estimated something, but ultimately you ended up collecting something, or you didn't even have an idea of how much data to collect. You had some time concept in mind. Say, for example, I have only 2 months period to collect data. Okay, so after that, what in order to justify that whether you collected sample is adequate to explain what you want to say, or adequate to explain the findings, to generalize your findings, then what you should do is you can study ex post facto power study. You mean to say, like, you can use the similar formulas to study the power. Okay, so and suppose if you are making some claim that, say, for example, the cognition is important in hearing impaired, for instance. So then if you want to make such statement, so then your methodology should have adequate, or your study should have adequate power to state that, right? So that also you should keep in mind. Okay, so if you have a predetermined sample size, then it is fine. If you do not have predetermined sample size, right? Okay, so then at least we should consider mentioning the power at the end of the study, right? Okay, so if you mention power with sample size also, it's fine, because sample size is an estimation, but then power of the study is a determinant, right? Okay, yeah. The next is sampling method. So you have many ways of sampling. Okay, so I'm not going into the details of it, because but then you should mention the information about the sampling method here. So whether you chose a convenient sampling or random sampling or stratified random sampling, etc., etc. And then you should have sample characteristics. Suppose if whether your sample is of particular age, right? Say, for example, I took people with CAPD, but they were in age range of so and so, and whether it include both the genders, socioeconomic status, whether they have any other additional problems, etc., etc. They all should be mentioned in this section, right? Okay, so that is about the first portion about participants. So typically you would have studied in papers like, a total of so many population, so many individuals were recruited for the purpose of the study, like that it goes. So that's the section which we talk about participants. Okay, so and then the participants, once you mention about the number and the size and its effects, etc., etc., so then you come to about the inclusion and exclusion criteria. This is also some section that which we have to pay due attention. Okay, sometimes it can affect the generalization of the study. Okay, so in inclusion criteria, say for example, the people should have some particular diagnosis of, right? So that is an example of how to write and means what is considered as an inclusion criteria. Say for example, should be parents of autistic or ADHD or ALD, etc. That there should be people, those who have annual income of so and so. So these are the kind of criteria that you keep for including. Okay, so suppose if you say hearing loss, you can say that in inclusion criteria you can write that so people with moderate, less than moderate degree of hearing loss were taken. So those are the potential population that you wanted to include, etc. Right? Okay. So and then exclusion criteria. Often people get confused between inclusion and how to write this exclusion criteria. Okay. So exclusion criteria is something that is done after including into the study. Say for example, say if my target group, so suppose if I'm studying some normative study, if I'm finding out, say for example, let's take the same example like binaural interaction in school age children, right? Okay, so by that I define a particular age, say for example 5 to 10. Okay, so this is my target population, so this is my inclusion criteria. Okay, so my inclusion criteria is school age children between 5 to 10 years of age is my inclusion criteria. And then what do I do in exclusion criteria? I go to school, I include all of them as potential participants, but then after some administering some measures, so I exclude selectively some people from the included. Okay, so based on some characteristics like psychosocial illnesses. Suppose if I take people with tinnitus, then I would exclude people with some severe psychosocial illness. So they might be of particular medication use or some alcohol use, etc. So basically, if I say tinnitus as my inclusion criteria, right? Okay, so I should define what degree and etc., etc. So anybody who fits inside that, okay, so if anybody has these characters among the people those who I have included, if anybody has these exclusion meets this exclusion criteria, because I decide this because this would affect my findings, so that's why I exclude them. Okay, so this thing can be excluded. Okay, so what generally should be avoided is, say for example, if your study inclusion criteria itself is men, then women is not your exclusion criteria, right? Okay, women doesn't even be a part of your study, so you cannot be excluding again. So some people tend to write like those who give consent we included, and exclusion criteria include people those who do not give consent. Obviously that is also not correct. Why? Because the inclusion criteria is defined as among people those who give informed consent. So among them you should exclude those who have certain other undesired characteristics, okay, etc. So I hope you have understood what I meant to say. Yeah. So this is an example of an inclusion and exclusion criteria. Say for example, the participants were 42 adults who met the criteria of moderate hearing loss. The sample was from South India, consisting both males and females. Okay, so those who are native speakers of Kannada language. So these are all inclusion criteria. And then I say, and their characteristics. And then I say participants with known psychological illness from low socioeconomic status and self-reported type 2 diabetes were excluded from the study. So like that. These are all hypothetical. Don't ask me why do I exclude for moderate hearing loss and T2DM. So I'm just writing for the sake of example sake. Okay, yeah, so that way. So this is how we write inclusion and exclusion criteria and sample characteristics. Yeah. So next is instrumentation and material. Okay. So instrumentation material is very, very essential. Okay. So if it is a dissertation or thesis, we dedicate a separate section for describing this. But if it is a manuscript, then it is a part of the methods. Okay. So without a subsection, you go on explaining the instruments that you used. So there are standard way of addressing, reporting the equipment. Say, for example, if I use neuroscan, so then I report with model, manufacturer, and from which country of origin or the headquarters is. Okay, so and then if it is in software, again, it has to be pretty much same thing. Suppose if it is some software that I use, which is of open source, then we need to address the actual study. Okay, so that first reports this type of software use, like each lab needs, then it is 2004 article. Okay. Yeah. And then what is worth mentioning is, suppose among them, apart from the equipments and softwares, we also might use some questionnaires and like stuttering severity index, tinnitus severity index or tinnitus handicap index, etc., etc. If you are using such a tool, then you should make a point that you also report some of its psychometrics, some of the tools psychometrics in this method. Say, for example, say if I use THI, then I would write that THI is a sensitive tool that is quite often used in literature for studying the treatment related effect. Okay, so etc., etc. It has shown excellent test retest reliability, internal consistency, and it has shown a responsiveness to treatment, like that. Okay, so which means to say that I'm not taking some outcome measure that is not known to change with my experimental manipulation, then it is not advisable. Right. Okay, so it is must that you should mention the tool and its psychometric properties and its responsiveness, right, is among few. You can mention like whatever. If you say that it is gold standard, you can mention it as a gold standard or standard screening instrument or standard diagnostic equipment instrument, like that. Okay, yeah, so that is about the instrumentation and material. So and then we'll go about procedure, right? Okay, so in procedure, it is very important that you tell the reader how you did the study, in the sense like the order, including the chronological order, like first you did what, second you did what, third you did what, etc., so that the reader can actually understand how you did, and in fact, if he wants to redo it, he will have an idea what is the way in which it was carried out. Right? Okay, say for example, this procedure should include how did you recruit the sample. So if we mentioned about, say for example, school-age children, people with hearing loss, or people with tinnitus, etc. Okay, so you need to also mention from where did you take and what is the method of procedure or the sampling procedure that was used to recruit the samples. See, most of our studies are convenient sampling, but we should remember that randomized control trial are the highest regarded study methods. Right? Okay, so you should mention the how did you recruit? Okay, so and also the sampling procedure, right? Okay. For example, if it is a convenient sampling, so then we should say that the sample were recruited by posting flyers in gym or by contacting school organizations, headmasters, or school teachers, or suppose if it is hearing loss patients or tinnitus patients, then you should say that the patients visiting outpatient department of particular hospital was the potential places where we recruited the participants, right? And also you should mention who collected the data. It is must that we should reveal that they what kind of qualification they had, okay, while collecting the data. Say for example, a trained postgraduate student or trained undergraduate student could be a possible data collection person, right? Okay. Yeah, you should write the process and activities as such. So I'm just writing an example here. So data was collected from two group of participants. Participant was seated in audiology outpatient department of Kastapa Hospital, Manipal. Prior to start of the procedure, they were explained about the study procedure. Written form consent was obtained. The data was collected by postgraduate student. So initial demographic details were obtained and then followed by routine audiometry. Then they were instructed to fill THI forms. The overall time taken for the procedure was roughly around 30 minutes. So this is the kind of unfolding of the events that took place during data collection. This has all the information about the data source, convenience, sampling, right? Okay, so and then like the information about the consent forms, right, etc. Right, it is must that it has to be written informed consent. Oral informed consent is not acceptable. If it is child, you should collect assent form, child assent form, that also has to be mentioned. Okay, etc. etc. Yeah. If it is a complex interventional methods or complex procedures, then consider mentioning, consider including blinded pictures for the study or graphical representation, okay, of time events that took place. So there are some examples of one of my paper and one of my colleagues' paper. Okay, so you can see that I don't know SIT, LIT, I don't know what is this success, but these are different interventions because you can see how they have told in terms of time. Okay, so how this event took place, right? Okay, say for example, this is hourly interruption. So this is 60 minutes and then followed by 20 minutes and then 120 minutes and then 180 minutes, right? Okay, so in between they were sitting. Okay, so only this group were standing at every 60 minutes, and then this group was climbing stairs every 60 minutes once. Rest of the time, all the groups were seated. So this way, it will just help you clearly understand what went on. So you can see that. So at baseline, they did an computerized executive function test, right? Okay, so and then they also did some ultrasound scanning at a Doppler ultrasound at specific interval. So this way, it will tell you exactly what went on. Again, this is a simple, crossover randomized trial. So you can see that 6 days washout period, the same people were tested before and after. So the time of testing, right? Okay, so and what testing were there? First, they were recorded in like electrodes were placed, the computerized testing was done. Okay, so and then event representations were recorded. Yeah, but then before that, they were either seated or they were standing. With the same group were swept between. If the first group, if they were seated after 7 days of washout period, they were made to stand. If the first group was standing and then they were washout after a washout period, they were uh, made to sit. So you can see that counterbalance randomized. So this is a picture. Without this picture, I don't think it would be very easy to explain how the events took place in time. Okay, so I just use this as an example to say how graphical images can be used in the procedure section. Okay, so to explain how events unfolded in time, right? Okay, so sometimes even behavioral methods also needs to be explained with respect to time constant. Say, for example, this is one paradigm attention network test from one of my manuscript, and it shows how the paradigm took place. Say, for example, initially there was a fixation, and then after some time there was cue, and after some time there was some fixation, and again after some time there was targets. So after some time there was a post-stimulus fixation. So you would know exactly how it took place, because these informations are must in order to be in order to reproduce your study findings. Yeah. So, and then as a part of this, I did not cover the literature review as a means literature review under this manuscript writing or research proposal writing. Okay, so that the reason is it is covered as a separate webinar, so it will have whole stress on the literature, how to review literature and how to propose, means how to write the literature review reports. Okay, so we will see in that section. So that is the end of the presentation. So if you have any specific doubt, you can ask. Okay, so meanwhile, there are many best ways to write. Okay, so whatever I sticked on is whatever I felt that it would be necessary, minimum requirement in order to make a manuscript or a proposal better. So that's why I used this. But of course, it's not just limited to that. Okay, thank you very much for your patient listening. So now, if you have any doubts, we can answer. Yeah, Komal?
Sir?
Yes.
Uh,
Komal?
Yeah, good morning, sir.
Thank you. Yeah, Komal, tell me.
Yeah, so it was a very wonderful presentation, but my question is not related to this particular presentation. I wanted to know, like, let's say if we are writing some kind of a project, some kind of a grant, and they have a section for a budget, right? So how we can divide those, how to write to the components in the budget section?
Yeah, that's a very interesting question. Actually, it depends. Actually, it depends on the granting agency. Some granting agency has some policies. We need to read them very clearly. Say, for example, if you take ICSSR, so ICSSR doesn't even allow buying a printer. Okay, so they are very stringent on their criteria on equipment. So they, even if you say that this for this project it is deemed necessary to print so many forms or some transcripts extra, they are okay to rent, but they're not okay to buy. Okay, so that way. So suppose if there is no scope at all to write, so obviously we should understand that uh, the limitation. So we would not make any budget in that case for equipment. So everything would be for rent or outsourced, right? Okay, so otherwise, say for example, some grant, even recently I just I just got to read some grant proposal for Indo-German something in DST. So one of the criteria is they will not give any equipment, right? Any equipment. Okay, so they will not give any equipment and infrastructure. So you should not ask. Okay, so if the grant says that, again, equipment is out of it. So again, we will not ask for equipment. But the rest of it can be incorporated into the recurrent budgets. So that can be, depends. Say, for example, some of our projects include the remuneration for patients, because the IEC here will not allow you to run an RCT, randomized control trial, without external funding and without compensating for the patient. Okay, so if you do not compensate for the patient's time, if you do not pay them monetarily, right? So then there is no RCT that can be done. So obviously it is mandatory by the IEC. So whenever we write an RCT, then we make sure that you document that. Sometimes they give, sometimes they don't give. Suppose if the granting agency don't give, I just convert it into an observational cross-section study. I'll exclude randomization. But if granting agencies grants the grant, okay, so then we can go ahead randomizing and do a full-fledged clinical trial. Okay, so that way. Recurrent budgets and overhead, usually they'll give in general. Okay, so then apart from that, some contingencies. Okay, so contingencies also is possible. But you should declare what infrastructure you have first. So obviously there is no grant that is provided for developing an infrastructure, like making an except for one of my friend, I think. Okay, so who got it. Okay, so other than that, I don't know anybody who got an infrastructure grant. Infrastructure cannot be obtained using a grant. Okay. Yeah.
Thank you, sir.
Welcome. Yeah. There are some questions in chat box.
yes, sir. One.
Knowledge is only for introduction, right? And then you mentioned about setting several parameters of psychometric test, even if it is not a gold standard, but it is sometimes widely used. Should we mention this? Yes. Okay, suppose if you have a literature review on that particular test, which says that, say for example, one of the quoted example that I used in the slide is attention network test. Attention network test is not a gold standard, but there are systematic reviews on attention network test itself. Okay, so which means to say attention network test is one of the widely used tests. So you can use that systematic review as a reference. So what do we mean by widely used? Yeah, that can be, that definition may not be very constant among people. But suppose if it is well researched, if there are some meta-analysis, if there are some systematic reviews on that outcome measure itself, yes, then it can be considered valid. Yeah, Megha.
Good morning, sir.
Good morning, Megha.
As usual, very crisp and clear presentation.
Thank you.
This was regarding the instrumentation. So if we are writing it for a retrospective study, let's say like 5 years data we are writing,
Yeah.
and we might have used multiple instruments, maybe audiometer itself, two or more types, and OE itself two. So how do we write that, or do we write them specifically?
Yeah, if it is an audiometer of that level, then it is not a big problem. So we can state that standard clinical audiometer was used, and from a retrospective perspective, it is understood that it would have had different equipment. But then we can always mention that a calibrated clinical audiometer was used.
Okay, okay, thank you.
Any more questions?
Can you please elaborate what you mean exactly by power of a study?
Power of a study, there are some formulas that can be used in G power. Unfortunately, I just formatted my laptop very recently, otherwise I had. So you can use G power. Okay, so you can use you can put your means and standard deviation. Okay, so and then you will get to know how much is the power of the study. Suppose if the power of the study is above 80%, which means to say whatever you want to say can be kind of generalizable. You can also use Cohen's d, okay, to compare the mean difference between two groups. And if it is again mean, Cohen's d has some standards as mild effect, moderate effect, or above moderate effect, etc. So then again, if the effect size is high, right, because then we can say that our findings are highly generalizable.
Thank you. And what do you mean by THI form?
THI is trained as handicap inventory. I use a short form because I just copied it from a PPT.
Could you let us know a little more about the informed consent for the children?
Yeah, actually, anybody below 18 years of age. And so what we need is we need an child assent form, right? Okay, so the child assent form, anybody, adults, okay, so you can take consent from them itself,
Okay.
right? So, but then if they are children, okay, so if not 18, I think there is some criteria. I just don't remember exactly. I think children, especially, you need a child assent form, which means to say you need to get information from children also, and also you need to get informed consent from the parents of the children, right? Okay, so that is child assent form. And again, sometimes it also assent form is also needed for some disorders like dementia, right, Alzheimer's. Again, those people will not be in a position to give any consent. Okay, so they are not qualified to give consent at all, in the sense, like, say for example, if you do a study in dementia, and if you say that I took consent from the patient himself, it is not acceptable, it is not ethical. It has to be the caregivers of the parent, I mean caregivers of the patients. Only they can give consent form. In terms of adults, other than these type of constraints, okay, so then you can take consent from themselves. Vulnerable group, right, children, okay, so they have a different kind of getting consent form. And as of now, there is no oral consent is acceptable, so it has to be written informed consent, okay, so and that has to be mentioned. And as I did not mention in this method, this thing, so during procedure, you need to say that informed consent is obtained and you have ethical permission for doing this particular study, and if preferentially mention the ethical clearance number and CTRI number, clinical trial registration of India. Okay, so that also has to be submitted. That number also has to be mentioned, right? Okay, so and all the studies that are being done, even if it is observational, okay, even if it is cross-sectional, okay, so it has to be registered through Clinical Trial Registration of India as per ICMR norms.
Any more questions? So there's one question. Can more than one researcher be a PI for a particular project? And following concert format, is it mandatory for writing RCT paper?
Yes, consult guidelines is the standard way of reporting RCT reports. Okay, so it is must that we should follow consult guidelines for RCT papers. And more than one person as PI is not allowed in as far as granting agencies are concerned. But some publishers very recently, like some in MDPI and others, and some high-end journals, okay, so they are allowing more than one first author and corresponding authors. I still don't have experience of those, but I just heard. Okay, welcome.
Anyone has any more questions, please ask.
I think there are no more questions.
I think no more questions. Sir, as everyone said, that was a wonderful presentation too. So from introduction to, every sections of the research proposal you have gone through, really well explained, sir. I think through this, the research proposal writing will be improved for everyone. And there's a better clarity to write a research proposal, I believe. So thank you very much, sir, for the wonderful session. Look forward to more different topics from you again.
Thank you, Shwetha. Thank you so much. Thank you for giving me the opportunity just to interact with people. So it would be very nice if the PGs and UGs of our institutions could be a part of it, especially those who are about to write a research proposal.
Thank you. So the whole thing started with those people in mind itself, but the timings and everything was little difficult to track for all the colleges. So we just started off with one timing to all the institutes and everyone. So that's how it's going on now.
Anyway, recordings will be available, right?
Yes, sir, that will be.
Okay, Shwetha. Thank you so much, and thank you then for the entire organization, Ruben, Pinki, Shwetha.
Thank you, everyone.
Thank you. Bye. I'll leave the meeting now.
Awesome. Thank you, sir.